there, and welcome to the Behavioral Health Matters podcast with Magellan Behavioral Health of Pennsylvania. This is the show that aims to promote positive mental health, increase our understanding of behavioral health topics and services, and to reduce stigma. I'm your host, John Lees, and I am the member and family advocate at Magellan Behavioral Health of Pennsylvania here in the Lehigh Valley. On this episode, we'll be learning about NAMI of the Lehigh Valley with our special guest, Maggie Murphy, the Executive Director of NAMI Lehigh Valley. During our conversation, we learn about the history of NAMI and the work they've done to help raise awareness about mental health, fight stigma, educate the public, and advocate for policies that support the millions of people in the United States affected by mental illness. We also discuss some of NAMI Lehigh Valley's specific programs and resources, and discuss their plans to recognize Mental Health Awareness Month in May, including events and activities geared to help raise awareness. We also talked about how you can get involved if you're interested in supporting NAMI's work. And be sure to stay tuned at the end of the episode to learn how you can provide us with your feedback about the podcast and make suggestions for future episodes. And now, on to the show. Our guest on this episode is Maggie Murphy. Maggie is the Executive Director of NAMI Lehigh Valley. In addition to learning about her background, Maggie will help us to understand all of the important work and the critical role that NAMI plays in our community. And now, here's my conversation with Maggie Murphy. Hello there, Maggie, and welcome to the Behavioral Health Matters podcast. It is great to have you with us.
Hi, John. Excited to be here today.
Well, that's great. We do appreciate your taking the time to join us on this episode. Let's get started. If you could you share with our listeners a little bit about your background, including your current role at NAMI Lehigh Valley?
Sure. I've been Executive Director at NAMI Lehigh Valley for just over 7 years now. Earlier on in my career, I worked in the corporate world running executive education programs for 2 different consulting firms, and then moved into end-of-life care for about 20 years as an administrator, and it was time to take a break from that. And as I looked at other positions, mental health really appealed to me for a variety of reasons. One is I live with anxiety and depression, which fortunately is very well managed. But of course, that gives me an interest in this field. Mm-hmm. And I also found as I looked at end-of-life care and mental health care, there are incredible similarities. For example, it's something that most people don't want to talk about. They don't think it's going to happen to them. The family is an important part of the unit of care, and the best care really involves a team because you can deal directly with the mental illness, but if the other pieces aren't in place, if someone doesn't have secure housing, then it's very difficult to pursue recovery from mental illness. So that brought me to NAMI.
Very interesting background. Appreciate that. And hopefully that helps to orient our listeners to kind of get us started with this conversation. So if we could, let's kind of start with some of the basics. What does NAMI stand for?
NAMI stands for the National Alliance on Mental Illness. It is the largest grassroots organization in the country focused on mental health, and there are about 600 local affiliates like NAMI Lehigh Valley across the country. Wow,
600. So it's really, the footprint is quite large when you look at it from a national standpoint. And then I imagine having local representation helps because there may be particular issues in one region of the country as opposed to a different region. So that's really interesting. I didn't realize there were that many.
Yeah, it's a large organization, started in 1979.
Wow. Okay. And with that, let's just kind of continue on that track. If you could provide just kind of an overview of NAMI, maybe some of the history, just to kind of orient the listener to the organization overall and just some of those basic pieces.
Sure. NAMI National was actually started by a small group of people who were parents of individuals living with mental illness, and they realized that they were facing the same kinds of challenges and issues. And so they got together in the interest of improving the quality of life, both for individuals who are living with mental illness, who we refer to as peers, and for their family members. And NAMI Lehigh Valley was founded in 1983. in very much the same way. It was a small group of family members who started it, gathered around a kitchen table, and it has grown tremendously since then. We have a small paid staff, but we are very volunteer driven. We have a group of about 70 active volunteers.
Oh, wow.
And all of the programs we provide are free of charge. Those programs are often led by the volunteers. And we have support groups, education programs. We do a lot of community presentations. We do advocacy around legislation and issues related to mental wellness. And we also talk one-on-one with a lot of people who contact our office who are looking for help with some of the challenges that they're specifically facing. And if NAMI Lehigh Valley can't meet their needs, then we can often suggest another agency that can provide the services that they need.
So a lot of coordination, partnerships, and connecting folks with various resources, helping them to navigate on their path to recovery.
Absolutely. Yeah, we do a lot of that. There's so much power in partnering.
So if you could, can you talk a little bit about the importance of peer support within the NAMI programs? You mentioned families being an integral part of the process of how it came to be. And I'm wondering, how does it contribute in the way of recovery and resiliency for individuals with mental illness?
Yep. NAMI is in no way trying to act for certified or licensed professionals. We're not trying to replace them. However, we have a board member, Dr. Dennis Geiger, who's a psychologist, and he talks about the importance of peer support because while there's a therapeutic session that might happen once a week, in between that, it's often difficult for people to sustain their plan for recovery and to continue the therapeutic effect. So one of the things that our peer support groups and our education programs can do is help individuals to do that. It also lets them know that they're not alone, and there's a sense of community, an opportunity for people to just openly share experiences that they have and challenges they have. Our support groups are very positively focused. Certainly people have a chance to talk about what's going on with them in a given week, but at the same time, it's focused on recovery. It's not simply a chance for people to say, isn't this awful and I have all these problems, but a chance to support one another and say, this is working for me. What might work for you?
Wow. So there's that kind of universality of folks coming together and sharing their story and experiences that may benefit others as well. In terms of that kind of shared experience, maybe not the exact experience, but one where, they may build off of something they learned from someone else.
That's just right. Everybody's experience is unique, but there are all those common threads that run through them.
Yeah. And we've touched on family, but can you talk specifically maybe about, what NAMI does to support family members and kind of involve them in the process of providing either support or resources or some of the meetings that you described?
Yes, NAMI is fairly unique in that we do provide support groups and education programs for family members that are available to anyone who is 18 years or older, and who we define family very broadly. It includes close friends. We've actually had college roommates who are living with a roommate who had a mental illness, and they've come to our support groups to learn how to better support their friend. The support groups for family, sometimes are live, sometimes are on Zoom. Okay. And they provide people a chance to talk about what they're going through. And very often people come to us when their loved one has just been diagnosed. And they feel two things very often. One is that they're the only family that's facing these challenges. Yeah. And it is tremendously helpful for them to learn that they are not alone, that other people do know what this is like when they're going through it. And one thing they can learn from other people in the group is that it has gotten better, that their loved one has moved on from a crisis. Treatment works. When people have access to good treatment for mental health issues, that treatment, by and large, is tremendously effective. So letting families know that and know that there's hope on the horizon really makes a difference for them.
Yeah, that's interesting. We had an episode earlier on where we specifically focused on recovery and resiliency principles and some of those concepts. And that was the one takeaway I had through that conversation. So I'm hearing it again, and it's really powerful how much hope plays a role in recovery and helping to build resiliency, but also that kind of that experience of getting started, figuring out where you go, who you can lean on. Right. Is there someone to help you along the path? but also providing that hope that if others have accomplished these things, that I can move forward as well. And I'm sure for families who feel, the challenge of trying to support their loved one, that's, you have to build the hope for them as well, not just the individual.
That's right.
Yeah, and I really like that you mentioned, the definition of family. It's a very broad definition. To me, it almost sounds like team. So we've got, Team John, Team Mary, so to speak. So whoever is really a part of that support team, it sounds like you would be, engaging and really leaning on to take on a particular role and be a support.
Very much so, and I think that team concept is absolutely right on. And often the family members are advocating with professional providers on behalf of their loved one and working with those providers as another team member. So it really takes everyone working together.
Yeah. Can you give some examples of some of the specific resources and supports that NAMI of Lehigh Valley provides?
Sure. I mentioned our support groups and our education courses. The support groups have one group for peers, one group for family members. Those meet once a week. And as I said, they're really positively focused. They're focused on resiliency and recovery. And there's their drop-in groups, no registration required. And again, everything we do is free of charge. We also have 2 8-week education courses that meet typically in the evenings, sometimes on weekends, once a week, where people learn all aspects of mental illness, ranging from what various diagnoses might mean to tips for resiliency, communication skills with providers, all sorts of things. It's really very comprehensive. We also do a lot of education, and we do that with community groups. We do what you and I are doing today. We just talk to people. We have programs where we go into the schools, particularly middle and high schools, and help students realize if they themselves are struggling or they know someone who's struggling, how to maybe have a conversation or how to help that person talk to another adult and get them the help that they need. We have a terrific program called Hospital Wellness, in which peers go into the inpatient and partial hospitalization units in the hospitals, and they tell their own stories of hope and recovery. And that does a couple things. It helps to get rid of the stigma around mental illness, and it also gives people an example of that hope that you mentioned. That's so important, because peers can go into a hospital unit and literally say, 2 years ago, I was here in this unit as a patient, and today I'm teaching this class, working full time, enjoying life with my family, and it shows people that that can be them as well. We have faith-based programs for faith communities of any faith, and we're working with law enforcement as well as doing legislative advocacy.
Wow, so it's really expansive in terms of the variety of offerings, a lot of it geared towards that education, as you mentioned. And we'll touch on this a little bit later, but of course, the goal of this podcast is not only to raise awareness around various supports and resources in our area, but also that goal of helping to reduce stigma. So just by virtue of having this conversation, hopefully we help others to kind of learn a little bit and maybe feel a little more comfortable either seeking help if maybe they're not sure about how to do that, taking that first step, but also just simply having the conversation.
And now, a message from Magellan Behavioral Health of Pennsylvania. If you or a loved one are a Magellan of Pennsylvania member and have any questions about services, please visit www.magellanofpa.com for more information. And now, back to the show.
That it's okay to have a conversation about mental illness, mental health, and that recovery, as you mentioned, is possible. Hope is there. And so, that's really, it sounds like that's a thread that weaves through all of the various programs and supports that you guys provide.
Very definitely. One of the sort of taglines that NAMI National uses, and we do as well, is find help, find hope by coming to NAMI.
Yeah, perfect. I mean, that really does very succinctly say it all. Okay. What about community events? And we're going to talk about May in a minute and the month of May and what's coming up. But specific community events, do you get involved? Do you support them, sponsor them? What's your involvement with community events in this area?
Yes, we are very fortunate in that increasingly we're invited to community events. And those are all kinds of events, from health fairs and senior fairs to police department community night outs to special events that people sometimes manage for us. For example, we've had a couple of movies that have screened, and people have invited, the organizers of those screenings have invited NAMI to come, have an information table, and sometimes even to speak after the screening of the movie. So we will go anywhere anybody invites us. We do as much work as we can with the schools as well. We have peers who are wonderful in telling their own stories and helping to educate about mental health, mental wellness. And because the research has shown that one of the most effective ways to change minds and reduce stigma when it comes to mental illness is to have contact with somebody who's living with a mental illness. And if that can't be live, it works just as well on video. So we make sure that we're getting peers out in front of audiences to tell their own stories.
That's really wonderful. So it's just really a situation where if something comes up and there's an opportunity to get out there and tell the story and help folks to learn and kind of take any step that they might want to. Sounds like NAMI is right there, ready to roll.
We'll be there.
Yeah, that's really great. And I think it's a great approach. Again, just thinking about what we're trying to accomplish. We want to kind of take that same approach where it takes a village, and so
right.
When there's an opportunity to come to the table and partner and collaborate, I just think, again, thinking about how to reduce stigma and educate folks and raise awareness. I agree with you. It comes through interactions, conversations, and making sure that people can ask questions. And there's really no wrong question, and help folks to feel a little more comfortable, just to kind of seek help, and that it's out there available, and that it can help.
Right.
So thinking of resources, we talked about kind of how you do that in terms of in person. So I know you guys have a website for NAMI of the Lehigh Valley. If you could talk a little bit about the website, maybe give the website address, and then is there anything particular you wanted to highlight for listeners to pay attention to as they check out the site?
I do. We have wonderful resources on our website. The website is NAMI-LV.org. So NAMI-LV.org. What people can find on there is not only information about our programming and the calendar of our programming and how to hook on to those support groups or education courses, but also information on what to do in a crisis, both what numbers to call, who to get in touch with, but what family members can do or friends can do if someone is experiencing a mental health crisis. There are lots of community resources in addition to the ones that NAMI Lehigh Valley offers. So resources about housing, legal support, resources for veterans, for youth, for aging. We have some local and national news related to mental health on there, and also ways to contact us if someone is looking for assistance or if they're looking for a speaker or to have us come to an event. It's all there.
Okay, great. Wow. So it really does cover a lot of different types of information, a lot of resources, and a lot of ways to connect.
That's exactly right.
That's great.
And now, a brief message. If you are interested in learning more about NAMI Lehigh Valley, check out their website at nami-lv.org. The site offers valuable information, including what to do if you or a loved one is experiencing a crisis. It also offers other available resources and supports, and a calendar of upcoming groups, meetings, and other events. Looking to get involved? Well, the site has information about the different ways you can get involved in supporting NAMI and the work that they do. Be sure to check it all out at nami-lv.org. And now, back to the show.
Want to get into what's coming up in May, and so May is Mental Health Awareness Month. So I wanted to check in and see what are some of the events or activities in the Lehigh Valley that we'd want to promote for folks to be aware of. And if you can also talk just a little bit about the month of May and what it really means with it being Mental Health Awareness Month.
Sure. I'm really glad we have a Mental Health Awareness Month because it's so important. I wish it were Mental Health Awareness Year and this were year round, but we'll take a month. One thing I wanted to particularly mention is the Mental Health Awareness Walk. on Friday, May 3rd. That's in Bethlehem at the Daniel Rice Field. And that's a huge event. I know Magellan is involved with that as well. There's a resource fair in addition to the walk. There are speakers, there's music. Last year, I think there were up to about 500 attendees.
Wow.
And the resource fair includes not only mental health resources, but other resources in the community for things that might overlap with mental health. And in addition to that, of course, there are lots of local events. We'll be out doing lots of speaking during the course of the month. We're doing a lot of workplace events. So people have asked us to come into workplaces and talk about things like stress and burnout that their employees might be experiencing and tips for coping with that. Our big event is actually in September. We have a 5K and walk at the Allentown Parkway in September. But it's really, the awareness is so important.
Yeah. Yeah, no, it really is. And I think anything that we can do to help promote that, certainly that's, I've really appreciated the partnership with all of our community stakeholders in this area, the various provider groups, and in particular NAMI. I know myself, speaking from experience, I've attended the walk on a number of occasions. Really enjoyed not only the walk, but as you mentioned, the resource fair afterwards, both being able to talk about the work that Magellan does, but also, and more importantly, meet some of the folks out there doing some of this wonderful work. It really is a fantastic day, and and looking forward to the month as well.
Yeah.
Someone was interested and wanted to get involved with NAMI and kind of support the work you're doing or volunteer. How would they go about doing that?
Sure. They can contact the office or get in touch with us through the website. And we're always looking for volunteers because all of our programming is volunteer-led, and it's led by individuals and families who have lived experience with mental health, mental illness. So we have a fairly small pool of volunteers to lead that programming that we're drawing from because people have to be available to do it and willing to do it and have the skills. But then NAMI provides the training that takes place in advance. It often takes place just over a weekend. Might be Zoom, might be in person. And then we partner new volunteers with a co-facilitator. All of our programs are led by 2 facilitators. So we'll partner a new person with someone more experienced, and they can become comfortable in how we're offering this program. But we always need volunteers for that. We also need volunteers for our special events. In addition to our 5K and walk in September, we have a community dinner, usually in April, and we need people to serve and help us solicit raffle baskets and all those good things around that dinner. And they can also support us by donating. We are very fortunate in that we get generous funding from both Lehigh and Northampton County, but that doesn't cover the full cost of the services that we're providing. So in addition, we're very dependent on grants as well as individual donations.
So there's really no shortage of opportunity for someone who would want to be involved to get involved in a lot of different opportunities.
Absolutely.
And activities. That's great. All right, we'll shift gears a little bit again and maybe talk a little bit about how things intersect with the National NAMI office. So you mentioned it earlier, and that there are 600 plus offices across the country.
Right.
But can you talk specifically about Lehigh Valley's office and how that work intersects and the kinds of support that you get from the National NAMI organization?
We're really lucky because the national organization gives us tremendous support in that they develop what they call their signature programs. So those would be our education programs, for example. And those are evidence-based, and they've been vetted and tested. And they design a lot of the training for the volunteers, too. So there's consistency to it, and they know that it's effective. They also provide conferences and other educational opportunities so that the affiliates can both learn from experts and we can learn from each other. We draw from each other very often. We have sort of a statement. You've heard the expression, if you've seen one something, you've seen them all.
Yep.
So ours is a little bit different. If you've seen one NAMI, you've seen one NAMI.
Okay.
Because although we have consistency of quality and how they're delivered across our programs, we also have the flexibility to meet our community needs.
Right.
So, for example, the program I described, the hospital wellness program, is not a NAMI program.
Okay.
It's a NAMI Lehigh Valley program,
Right.
but not a national program. But we saw a need, so we had the full support of national in offering that program here. So we're always looking to identify community needs and see how we can help to fill those. So we've been very lucky to have that flexibility.
That's really great. So you've got the support and infrastructure created by the national organization, but you also have the ability locally to identify a particular gap or need, and then kind of tackle that here locally.
Exactly. And in between national and affiliates, we also have state organizations. Here we have NAMI Keystone, which is the Pennsylvania Statewide Association.
Okay. So there's really a lot of strength behind the local offices, but again, that latitude to really get creative and identify kind of particular things from a strategic planning standpoint to work on, and then get the support to be able to do that from the national organization.
Right.
That sounds like a great setup. So in terms of strategic planning, I know we wanted to touch on CIT. You had mentioned that previously, and I just wanted to give you the opportunity to kind of tell us what that is, what the acronym stands for, what the program is, and be able to kind of share that with our listeners.
CIT is a terrific program. It stands for Crisis Intervention Team Training. And this is a program that we do mostly with law enforcement. There's an international CIT organization, and they have partnered with NAMIs to offer training for law enforcement in how to interact with somebody who is experiencing a mental illness crisis. And the goal is it's twofold. One, to keep everyone safe, both the individual as well as the officers, because they have to make such quick decisions in these situations that if they have training and they've modeled and role played these situations, they're going to be even better equipped when it happens in the field. And the other is to help reduce some of the stigma. There is both stigma, of course, as we've talked about, for mental illness, and there's some stigma about law enforcement too, that, officers don't understand what that's involved when somebody's having that crisis. So we're helping reduce that by training them. And we're also learning from the officers. We're learning what they need from the public and the community. So it generally is a 40-hour training over the course of a week. And right now we're training not only police officers, sheriff's deputies, sometimes probation officers, but we're also expanding into corrections officers.
Oh, wow. Okay.
Because such a high percentage of the incarcerated population is living with a mental illness. And soon we're hoping to train 911 dispatchers so that when somebody is in crisis and calls them, they can be supportive and gather the information that the officers are going to need when they respond to that call. So we're partnering both with Northampton County and Lehigh County to provide that training, and we're really excited about it. And we at NAMI are learning so much about what law enforcement officers are facing.
Yeah, and I think that kind of approach really lends itself to a good partnership because, as you mentioned, you're doing the training of the officers and the other first responders and those key personnel, but you're also open to learning about how they operate. So, as communication is happening in terms of training, you can adjust if you need to, if maybe there's some shared learning there and something might work a little better or a little differently than maybe you thought going in. It gives you some flexibility to do that, but also I think promotes that positive communication and relationship.
I think you're absolutely right. And it doesn't really stop at the training. We're trying to partner with community efforts awareness. There is a wonderful program called Hub that the Upper Macungie Police Department is doing, where they bring together different government and non-governmental agencies and talk about situations in which perhaps the police have been called to a home over and over and over again. And there's a mental health or substance abuse issue in that. And so we bring all those resources to bear to help that family.
That's really wonderful. And I'm glad to hear that in our area that our first responders are open to this. I think it's, you hear a lot in the news about unfortunate circumstance and situations. So to me, you mentioned stigma and that's a big part of the process. But I think it also goes back to what you talked about at the outset, which is education. And so starting from a place of we're here to help and support and educate, and really promote safety for everyone involved. So I'm glad to hear there's been positive responses and hopeful that it continues to see success and benefits our community.
Yeah, very definitely.
Yeah. Okay, so kind of staying on the topic of stigma, as I mentioned, the primary goal of this podcast really is to reduce stigma. It is to promote programs and organizations like NAMI of the Lehigh Valley and other provider groups and stakeholders. But really, we want to have conversations, and we want to make sure that people are able to, listen to conversations that help to educate them, but hopefully help them to feel more comfortable themselves having conversations. So I just wanted to get your perspective, if I could, on the issue of stigma and mental illness. Any specific efforts, and you mentioned a couple already, related to reducing stigma as a focus. And then, if you can, any comments on, have you seen progress in this area? Are we moving forward? Are we making progress in helping to reduce stigma overall?
Yeah. I think my overall perspective of stigma is, at this point, it needs to go away. It's time. This is 2024. It's time to understand what mental health and mental illness really is. NAMI uses a number that 1 in 4 American adults in a given year will experience an episode of mental illness. That means this is touching everyone. And, if you think you don't know somebody who's living with a mental illness, you probably do. And it's an illness like any physical illness. And we tend to talk about it in terms of a continuum, in the same way that physically, most of us are not completely 100% never had a cold, healthy.
Right.
And fortunately, most of us are not dealing with a very serious life-changing issue. Mental illness is exactly the same. It has that same spectrum. And most of us fall somewhere in the middle. And it may be a diagnosable real mental illness, or it may just be an episode of anxiety or depression that is treated and then someone moves on. Or it might be something that they need to manage, just as we would manage any other chronic disease like diabetes, high blood pressure, etc. So I think we really need to understand that mental illness is not one thing. It is a range. And as I mentioned earlier, treatment works. If we can get people access to treatment, for the most part, it doesn't cure the disease, but it really helps. We're now using the term remission as we talk about mental illness. People can be in remission, may flare up again, may not, as long as people continue with maintaining their treatment plan and doing what they need to do to be healthy. But I think we really need to think about mental illness as something that can impact anyone.
Yeah, all walks of life are
all
affected.
Walks of life. Yeah.
Yeah, and I like that the main kind of way that it was framed was really around the language. You think about total health. To me, that encompasses our physical well-being, as you mentioned, but also our emotional and our mental health. And so, to your point, we're not always all at the top of our game, and so there is that range or that spectrum, right? And if it gets to a point where someone is in need of additional support, it is available, and it is okay to ask for that. And if we were having a physical health issue that we tried to cope with ourselves, but we weren't feeling like we were really successfully knocking out, whether it be a virus or what have you, we would probably seek a medical professional to get some kind of medication or intervention that would help us. So how is mental health really any different?
Right. It's not. And that's very true. You wouldn't try to cure cancer by yourself.
Right.
And same thing.
Yeah. And it's not just that there are healthcare professionals out there and available, but there are all these other wonderful supports that you mentioned. And it's so about, it's really about helping people to understand what's available, that it's okay to ask for help, and that it can help to provide that hope. And I hadn't heard the word remission as it relates to mental health, but it's interesting that you describe it that way. And I think it's a great way to look at it, really. And kind of building off of that part of the conversation, I'm interested to know how NAMI engages with diverse communities and address cultural consideration in your advocacy and support efforts.
Our programs have always been open to anyone. But we've recently been focused on being more diverse and more inclusive in who we're serving. And to that end, we have hired an outreach coordinator who's focused on reaching out to historically underserved populations in the Lehigh Valley. And he is somebody who is bilingual English-Spanish. He has lived all over the world. He's a former professional soccer player. So he's in a good position to relate to a lot of people. And he is building partnerships and relationships between NAMI and leaders in communities that we historically have not been as active with, so that we can find out what their needs are. Because what we don't want to do is go in and sort of say, here are our services, they are wonderful, you need them.
Right.
We're trying to find out from some communities that have particular cultural needs or cultural barriers to mental health care, what they need, what's going to be helpful for them. And then if we don't have a NAMI program that's already been developed to meet those needs, we have that flexibility to be able to put one together.
That's really great. So it goes back to that capability locally to understand what the needs are of a given population, what the trends look like, and if there are those obstacles or barriers to try to, outline a program or support that would help tackle that issue and make sure that they're able to access whatever care or support they need.
Right. And we're learning a lot as we do that.
I was just going to say, and I imagine it helps to shape and inform the work you do overall, and maybe in some of your other programs also.
It really does.
Yeah, that's wonderful and such a great approach. So as we start to wrap up, this is the time when I we've covered a lot of ground. We've talked a lot about NAMI locally and nationally. All the wonderful support that you provide, the partnerships you've established. And if you could, and this is tricky and a challenge, but if there were one thing that you wanted the listener to really walk away, having learned about NAMI of the Lehigh Valley, what would that be? I know it's tough to boil it down to just one thing, but if there was really one thing you wanted folks to learn today, what would that be?
Could I say two?
Sure. Actually, you could say as many as you want, but this is the part where we really just want to help listeners to, have learned something through the conversation that we've had. That's kind of our mission. Yeah. So, but say as much as you need to, certainly.
The first and most important one is if you are an individual who is living with mental illness or a family member of somebody who's living with mental illness, you are not alone. We are here. As we mentioned earlier, everyone's experience is unique, but there are very common aspects of that. Other people have been through it, and that having that community can be so, so helpful. So I hope people know that, and NAMI Lehigh Valley is here to support them in that. The second one is that there is strength in asking for help. This is an illness like any other illness. And if you feel like you might need mental health support, and you don't even have to be certain, if you feel like you're struggling, talk to someone about it. And it might be your primary provider who you start with, primary medical provider. It might be just a friend or a family member. And then they can help you talk about that more and talk about your needs and get you connected with treatment. But don't hesitate to talk about it.
What a great message. And again, I to me, it comes down to helping folks to feel comfortable with that first step. From what I hear from folks who have shared their perspective and their experiences, that first step was the probably the scariest. Not quite sure how to say what was happening, who to say it to. But once they were able to do that, they really described that things start to move. They start to feel that support, access that care and treatment, and kind of get on that path to recovery, as you mentioned. And so it's so great to know that first step could be through the NAMI of the Lehigh Valley and the wonderful folks there who would listen, kind of help assess what might be make the most sense in terms of the first step and help them to take that step.
Please, if we can help you in any way, don't hesitate to contact us. That's what we're here for.
That's great. And I know, again, from my role at Magellan, I interface quite a bit with NAMI and the folks there, and it's a wonderful collaborative relationship. And I've felt support. I've learned things that have helped me. So it's certainly a wonderful resource. We really appreciate your coming on to talk about it, to share it with our audience, and thank you very much for that.
Thank you, John. It's been a pleasure to talk with you today.
Thanks again.
Stay tuned. We'll be right back to wrap things up. So what did we learn on this episode? Well, we learned that the families and the members of NAMI Lehigh Valley are here to help. And we learned that they do this by working to improve the quality of life for people with mental illness and their families through education and advocacy. We also learned that their support and services are open to anyone and are free of charge, and that you can learn more by checking out their website at nami-lv.org. And lastly, we learned that if you're interested in volunteering or helping to support the efforts of NAMI Lehigh Valley, you can reach out directly or check out the website for more information. We'd like to take this opportunity to thank our guest on this episode, Maggie Murphy, Executive Director of NAMI Lehigh Valley. We'd like to thank all of you for listening to this episode of the podcast and invite you back for our next episode. And please remember, if you have any questions or feedback about the podcast or have suggestions for future episodes, send me an email at jglees@magellanhealth.com. We love getting your feedback. Well, there's the music, so that does it for this episode. I'm your host, John Lee, saying goodbye for now. And please remember, behavioral health matters.